Welcome to The Explainer. Today, we're taking what usually feels like super dry academic pharmacology definitions and flipping them into a really accessible, fast-paced crash course. Seriously, if you've ever stared at a medicine bottle and wondered how that tiny little pill actually does its job inside of you, you are absolutely in the right place. Let's get right into it. First up, I want to challenge a totally everyday assumption. What exactly makes a medicine a drug? I mean, we throw that word around all the time, right? But the scientific reality of what a drug actually is, it's way broader than you might think.
So, clinically speaking, a drug is literally any substance or product used to modify or explore physiological systems or pathological states for the benefit of the recipient. Okay, what does that actually mean? Well, it means it's not just about curing a sickness. It's about intentionally tweaking a physiological event. Take contraception, for instance. You aren't treating a disease there, right? You're just modifying the body's natural systems to achieve a highly specific, beneficial outcome. It's a whole different way to look at it.
Okay, here's our roadmap for this explainer. 1. The basics of pharmacology. 2. Categorizing and naming drugs. 3. Digestive delivery, so enteral routes. 4. Direct injection, which are parenteral routes. And finally, 5. Beyond pills, looking at other specialized delivery routes. Let's kick things off with Section 1, the basics of pharmacology.
Let's totally strip away the intimidation factor of these medical terms, because pharmacology basically splits into two main areas. They sound super similar, but they represent a giant conceptual battle of cause and effect. First up, pharmacodynamics. Simply put, this is what the drug does to the body. It's how it affects you, whether you're young, old, completely healthy, or sick. On the flip side, you've got pharmacokinetics. Now, this is what the body does to the drug. Like, how does your system actually absorb it, break it down, metabolize it, and eventually get rid of it? But look, the absolute most crucial point here is this quote. Its objective is to optimize drug therapy. Everything we study in clinical pharmacology, running formal trials, monitoring safety, figuring out a drug's true value, it all boils down to finding the absolute best, safest, and most effective way to treat patients. It's taking all that complex science and putting it to practical use for us.
Moving right along to Section 2, categorizing and naming drugs.
It is wild when you realize that our medicines come from such a massive, diverse toolkit. I mean, they come from plants. Think morphine and quinine. They come from animals, which historically give us insulin and heparin. We literally get iron supplements from simple minerals and penicillin from microorganisms. We've even got purely synthetic sources for everyday stuff like aspirin and paracetamol, plus mind-blowing genetic engineering giving us human growth hormone. It's kind of like a giant puzzle sourced from all over nature and science. Now, if you've ever been totally confused at the pharmacy, here's why. Every single drug has multiple names. First, there's the chemical name, like N-acetyl P-aminophenol. Try saying that 5 times fast. It's a total tongue twister describing the exact molecular structure, but obviously way too complex for the real world. So then you have the generic, non-proprietary name, in this case, paracetamol. There's only one generic name per drug, which is super helpful for reducing prescription errors. And finally, the trade or brand name, like Cerplex. This one is copyrighted by the manufacturer. So yeah, one generic drug can have a bunch of different and usually much more expensive trade names depending on who's making it.
All right, Section 3, digestive delivery, also known as enteral routes.
So, how do these drugs physically get into your system? The most common way, the oral route, just swallowing a pill, is simple, sure, but it has some major vulnerabilities. That tiny pill has to survive an absolute gauntlet. We're talking harsh stomach acids and really aggressive digestive enzymes. Some drugs, like penicillin or insulin, they get completely destroyed right there. And even if they survive the stomach, before a drug hits your systemic circulation, it often gets intercepted and heavily metabolized by your liver. It's called the first-pass effect. A drug like nitroglycerin, over 90% of it gets metabolized this way. It makes absorption incomplete, kind of irregular, and definitely way too slow if you're in an emergency. To get around that whole digestive gauntlet, we have some clever oral alternatives. Sublingual administration is where you just place the drug under your tongue, and buccal administration places it right between the gum and the cheek. Now, you do not swallow these. Instead, they just sit there and allow for rapid absorption straight into your bloodstream. It totally avoids the harsh stomach acid and skips right past that pesky first-pass liver metabolism we just talked about. But what if it's an extreme emergency? Or what if the patient is unconscious and literally cannot swallow?
That brings us to Section 4, direct injection, or parenteral routes.
Doctors actually have an incredible array of administrative routes available to them across the entire human body. Parenteral routes basically mean using a needle and syringe to introduce the drug directly across the body's barrier defenses, right into the systemic circulation. It gives them a ton of options when they need to completely bypass the digestive tract and get that drug exactly where it needs to go, fast.
Think about the different layers of human skin and muscle. When a doctor uses a needle, the lengths and angles aren't just random. They are penetrating to very specific depths, and that depth drastically changes exactly how the drug is absorbed by your tissues.
Let's break those depths down step by step. First, intradermal. This goes right between the inner and outer layers of the skin. They usually use tiny volumes here, mainly just to test for reactions, like a TB test. Then, subcutaneous. This goes just slightly deeper, to the tissue right below the skin. It's really common for things like insulin. Next is intramuscular, which plunges deep into the actual muscle tissue. This is great for moderate volumes and oily preparations. And finally, intravenous. This bypasses the absorption process entirely because it goes directly into your blood through a vein.
Now, common intramuscular sites, like your deltoid in the arm or your gluteal muscles, have really deep blood vessels, which makes absorption super prompt. But compare that to a direct intravenous line. An IV produces an immediate effect. It allows for highly accurate, continuous dosing, which is exactly why hospitals use it all the time for larger volumes of fluids.
But here's the catch. With that speed comes risk. Yes, direct injections are highly bioavailable, they're incredibly rapid for emergencies, and they are perfect for unconscious patients. However, the crucial takeaway here is that they are totally irreversible. You cannot recall a drug once you've pushed it into the vein. Plus, they obviously carry a risk of pain, fear for a lot of people, and they absolutely require strict, sterile conditions so you don't introduce an infection.
Okay, last up, Section 5, Beyond Pills, Other Routes.
There are a few other highly specialized routes that allow for incredibly targeted treatment. The rectal route, using suppositories or enemas, is actually really useful if a patient is vomiting. And interestingly enough, it reduces that liver first-pass effect by 50%. Then there are topical applications. These are put right on the site, like a skin cream or eye drops. Finally, inhalational routes. These let drugs enter the bloodstream by diffusing super rapidly right across the alveolar membrane in your lungs. It's exactly the mechanism behind an asthma inhaler or a volatile anesthetic.
So, pulling it all together, pharmacology is obviously a massive field, but basically every single drug falls into one of these distinct, purpose-driven categories. We use them for symptomatic relief, like grabbing a cough syrup, curative elimination of a disease, like taking an antibiotic, preventative measures, like vaccines, suppressive management, maybe for high blood pressure. They're used as diagnostic tools, for general health maintenance, or for contraceptive purposes. Every single drug has a very specific mission.
Hopefully, this explainer gives you the power to look at your everyday prescriptions with a totally brand new clinical perspective. Seriously, the next time you open your medicine cabinet and pop a simple pill, ask yourself, what complex gauntlet is this tiny molecule about to run inside my body? Is it surviving an acid bath right now, or is it cleverly bypassing my liver altogether? What's going on in there?